Hi, everyone. Welcome back to Right in Front of My Face, the podcast talking about big things happening right in front of us. I'm your host, Shannon Hull, and I'm coming at you on day 60, whatever, I actually don't know, of quarantine. And I have a confession to make. I'm exhausted, like all of you, but I'm still here. My anxiety is amazing because it serves as that little voice in my head that says, don't stop this because you're tired. Keep going. You can do it. So here we are. I wanted to circle back with Dr. Allison Drake after a couple of months to get her pulse check on COVID-19 and where we've arrived after 2 months of sheltering in place. The week after our last interview, she co-authored an op-ed that was published on thehill.com. Two epidemiologists outlined what I thought was a really smart plan to create a reserve army of public healthcare workers to begin contact tracing efforts, and I wanted to know how that article had landed within her community. I'm struggling to understand a lot of things, as I know we all are, and as it turns out, so is Dr. Drake. Testing, going back to school, summer, all these things remain murky. So much is murky. I find myself wanting to talk to the person with the answers, only to continue realizing that there isn't that person. They don't exist. I talk with Dr. Drake about my extreme level of confusion and how conflicted I feel about what's happening. I know I'm not alone. Dr. Drake and I talk about fatigue, Zoom fatigue, being at home fatigue, all of it. And this interview turns more personal. The bottom line is that we miss each other. We miss our life. This is difficult. But I always enjoy Dr. Drake's practical take on how to handle continued social distancing. I find her very empowering and I find her advice practical. I hope you take something away from this conversation. I just kind of want to dive right in because shortly after you and I spoke, Dr. Drake, you published what I thought was a pretty powerful piece for thehill.com. The title of the piece is Now is the Time for a National Public Health Reserve. And I'll summarize it quickly. You advocated really strongly, along with your co-author, for a reserve army of public health workers. You suggested that putting schools of public health to work might be a really effective strategy for beginning contact tracing efforts and helping isolate and contain cases of COVID-19. Your point is that there are about 12,000 trained public health graduates that could supply a pool of volunteers to track and trace. We had talked about this a little bit in our first interview, and I just wanted to follow up and kind of see how that was received and if anything came of it afterwards.
Well, I think that in my own UW community, there was, general support for it from, other people across the country who I knew who liked the idea. But when you're looking at limited resources and where you're putting efforts and priority and trying to organize something that large, as well as perhaps distrust of the government being able to coordinate this, and really seeing, after we wrote that, I think still understanding how this epidemic has really been controlled at the state level. And that's really what's happened is the states are really responsible for figuring out, how they're going to do things, how they're going to get tests, how they're going to do contact tracing, and it's not coordinated at a national level. So really the take home is that we didn't see anything really materialize after that. And I think where we really started the op-ed from was a point of really thinking about contact tracing specifically, even though we broadened it because there's lots of things that people could do. And there are many volunteer websites that collect data on people who are willing to do things for in response to the pandemic. They include everything from, meal delivery and laboratory testing. And contact tracing has become part of that, and some states have done that. But it has been surprising that we haven't really capitalized on our public health community, as well as a lot of people who are, out of work and could contribute to this effort. With, if we need a lot of contact tracers, we just need bodies. Obviously, people who have training in public health, it's nice, but it's not that technical. Someone could be trained very easily to do this. And the idea with a national program would be that the efforts that you invest to hire someone to do contact tracing in one community, when that epidemic is over, you've already invested in training that individual who, with remote work, could then just plug into another community when their epidemic hits. So it seemed like it would have been a really efficient way to do that, but it's very community dependent on how people are responding to the epidemic, both at the local, city, county level as well as the state level, and definitely not seeing a lot of national coordination on any of the epidemic control measures.
Dr. Drake, can we talk just a little bit about the movements that are growing, that are starting to question the government's data and states' decision-making process? There are two groups that I can think of off the top of my head. The first one is the group that released the movie Plandemic, which I haven't seen, but again, talks about conspiracy theories, et cetera. The other group I can think of is a group called Reopen Washington, which has grown to almost 37,000 members. And their point, honestly, is not necessarily that they are questioning the virus, but the state's response to it, because the data is so muddy. Can you speak to that at all?
Well, I think when you're looking at data, that data can often be manipulated to show a story that you want it to show. And I think it's understandable that people have some mistrust about the way that the numbers are shown, what information we have, what's not being shown. And, I have my own questions about like, well, why don't we know this and why don't we know that? And I can't tell if it's purposeful, that there are some pieces of information that they're not ready to release yet. So one example would be, and this just came out this week in New York, where they showed 66% of all of the recent cases were people who had been, quote, at home, as opposed to an essential worker or healthcare worker in a retirement community. And so it really begs the question about like, where are these cases coming from? And if everyone is really truly sheltering at home, why are we seeing so much transmission? What that data point doesn't tell you is, are people who are, quote, at home, are they really practicing social distancing? Are they, including just the one friend or the grandparents, and who's in their network, in addition to it being a very densely populated community? So it's more difficult to practice social distancing if you're sharing an elevator or, passing people in hallways in apartment buildings. So it's hard to know that, but to me, I do think that there should be some understanding of what the risks are. And I did see something from Washington State come out this week, I mean, it was even yesterday, about, really, if you're looking at outside activities like going for a walk, passing someone when you're outside, that really like those are theoretical and small risks. And that's not really the primary concern. Still, like that's still the messaging, but it would be helpful to have a better sense of like, who are these recent cases, and is it because the social distancing practices are not being well implemented?
And it seems to me like the data has actually changed since the beginning. And even the IHME is saying that the deaths reported each day can include deaths from 25 days ago. I'm wondering if that is a standard practice for public health, and if you can explain how that data has changed, because it's starting to feel, not only to me, but to a lot of people, like it's being a little bit manipulated.
Yeah, I think data is messy, and that's partly because of how long it takes to get the test back and when that test is released. I think the tests done that day are reflective of that day, whether the cases are reported based on the day that they were tested or based on the day that the sample was collected. And in many places, that's the same day, but not everywhere. There are many other places where you're waiting, a long time to get that information. And there's always kind of a delay in reports of mortality data, which is problematic when people are looking at what the mortality rate really is. And if there are delays in reporting of those deaths, then likely what we're seeing is an underreporting of mortality, because it just takes time for that information to be processed. So it can be hard to look at the models. However, what I will say about the models is, one, I think people are increasingly using multiple models to make decisions, and every model is flawed. No model will be very predictive of exactly what will happen in the future, because no one has a crystal ball. So the data that we're collecting now is used to inform revisions to the model, and all models require assumptions. And as more data comes in, then you kind of can correct your model, incorporate past patterns, and project forward. And different models have different strengths and weaknesses, but together they can be used to say, like, are we seeing the same thing? What are the assumptions of this model? What if we looked at this other model? And there was one that just came out in the New York Times that really was showing projections for basically 2 years of showing what different waves could look like. And that's kind of the new concern, is that, we're just at the very first wave. And I think most people believe that there will be a second and subsequent additional waves following this peak, that we're going to go through peaks and valleys, and what the shape of those curves look like, whether our next peak will be higher than this peak or the next peak will be lower, whether we'll get a peak in the fall again that's even greater than what we see now. The seasonality is a huge unknown, that for the last SARS epidemic, they predicted a second wave. It didn't happen. People don't understand why. This is a different virus. Most people don't believe that we won't see a second wave, but we definitely won't know until we go through the summer and we see.
In thinking about the second wave, at what point does it take into consideration things like people wearing masks? Does it take into consideration things like social distancing, like not going to restaurants? I mean, are those second wave models predicting the same behavior as before, or do they take into account habits changing?
Again, each model is different, and I don't know the specifics of each model and what their assumptions are without really kind of digging into each one to determine that. I do know that there are some projections about what people are doing now, and I don't think it's likely that they're assuming that those activities will continue in the same way that they are now, which can both mean that things can get locked down further, people can do more social distancing or continue what they're doing, but also that there may be kind of this like natural tendency for people to get antsy. I mean, as we're seeing, the weather is like very nice today in Seattle. We're going to see a lot more people out. The mask issue is very controversial. I think we see less of it in our community in Seattle metropolitan area, but I hear from my families across the country that there's a lot of backlash if you're kind of promoting masks, and a lot of judgment about who's wearing a mask, who isn't a mask, what does that mean if you're not a mask wearer. And, parts of the country that have opened up and government leaders who are opening up the country in larger ways than we have here, it's going to vary based on what people's behaviors are. And it's hard to know whether people are going to like stick with this or whether they will release it. But the new models tried to project like, well, what if we had this threshold and we said, if we start to climb to a certain number of cases, and then we were to have these waves of social distancing where the release valve would open, people would be allowed to do more. We started to shut things down over time, in a kind of logical manner. We shut down some things and we shut down more things. And so it gets stricter and stricter. And that release could happen in the same way, where you're starting to open things up slowly over time, but then you might need to clamp it shut again as, the number of cases reaches that threshold. And that's really to alleviate the burden on the healthcare system. So it does take into account, social distancing practices, but it's also modeling like, well, what if we were to have these waves where we say, okay, this is not sustainable to live this way for the next 2 years. How can we mitigate the impact? How can we, turn the country back on, stimulate the economy, let business go back to some version of normal, which is not going to be like the normal that we knew in January, but, return to something that resembles normalcy to keep the economy going, to keep people able to adhere to these practices when we need it.
So this kind of brings me to the question of testing, because two questions really. How much testing should we really be doing? And also, at what point does the tide turn and we say, okay, we need to quarantine the most vulnerable, immunocompromised, and the elderly, and kind of figure out how to all operate within this new normal? Will that happen? Does that make sense? Is that a misguided view?
Well, I think everyone agrees we should be doing more testing. There are some barriers to doing wide-scale testing that I think we've got a lot of infrastructure set up, and now there may be more concerns about some of the reagents and supplies and getting the swabs that are needed for testing. So that's still sort of in flux. It is increasing over time, but still is not at the level that we need to be doing testing. Those efforts are going to be ongoing. As far as a more tailored approach for the elderly, I mean, I think it's just going to be looking at the data. And sometimes I think it's helpful to think we've really only been in this, as we were just talking about, we shut down in Seattle in mid-March. We're just approaching our, 2-month quarantine or 2-month stay at home in some way, shape, or form for most people. And that, trying to project what the future is going to look like in a year is really hard. Like, things have already changed dramatically over this 2-month period of time. And that the thing that's most disconcerting for people is the lack of certainty, the uncertainty about what it's going to look like. And the answer is nobody knows what it's going to look like. So all we can do is really look at the data and look at the numbers to drive our policies. There are a variety of things that we can do, should do, might do, but to try to project and say, like, we will do this without having the data that supports it doesn't make sense either. What's hard about that is that it's hard for planning, right? People don't know when they can go back to work.
Right.
They don't know if they can, take vacations or see family members or just generally resume a social life. So that's hard. That's why everyone wants answers now. Like, that's, pretty universal. That's what most people are most uncomfortable with. But we really will just have to look at the data and the trends and make corrections. And that's why, like in Washington State, we have this like 4-phased approach, which, they're looking for key things to happen before they start to release that pressure valve. But it doesn't mean that the valve won't close again and that we might have to resume at the same level that we're doing now, or even before now, of shutting things down again if the number of infections start to climb and start to overwhelm our healthcare system.
If that was really a thought, though, that it could really overwhelm the healthcare system again, then why did we get rid of that field hospital we had?
Well, I think the field hospital was not needed at the time, and that because we have learned from what we have done so far on what we would need to avoid that from happening, the intention is not to let this go to a point where our healthcare system would be overloaded. It would be catching it before it gets to that point.
Right.
So as things start to get close to that, then it's the message of, okay, we need to shut things down again. We got to go back to like strictly adhering to social distancing. We need the number of cases to decline. And this is all really just a stopgap to get us to a time when we can start rolling out vaccines, which everyone is hopeful that we will have maybe sometime next year.
So let's talk about antibody testing for a second, because I got one. I found a little, there's a clinic by my house that was offering antibody tests. I was on their mailing list and I got one because I had a very weird respiratory illness, as did my kids, back in January. And the timing totally didn't match up, but I thought, well, this would be an interesting data point. My insurance paid for it and it was a little blood draw and I went in and it was negative. So I hadn't actually had it. But at what point is that data beneficial?
Well, I'll just start by saying I'm a little biased about this because I really am a believer that the antibody test results will be helpful when we start doing more of them.
I think so too. And I was kind of like, is this information going to, because I partially wanted to do it to say, hey, I have the means to pay for it if my insurance won't cover it. And I felt like that's a data point that would be interesting. I mean, I would think they would want everything, but I don't even know where the data goes.
Yeah, good question. So the antibody testing, first of all, some of the problems with the antibody testing is that the assay performance and the earlier tests, and even some of the tests that are still circulating, was not great. So if you have a lot of error in what your test results are, you don't know if you have a high percentage of false positives or false negatives, then if you have a low prevalence of COVID in your community, that your error rate could be very similar or even higher than the prevalence. That probably isn't true in places like Seattle and King County because our epidemic started here. We likely had wider community spread here, but we don't know that for sure. But I really think that the antibody test could be really helpful, as like the UW one, for example, uses a assay that has very high performance. It would provide information about like how many people have already been exposed and infected and perhaps asymptomatic or had maybe mild symptoms earlier on in March or something.
That was my main question, because talking about the asymptomatic carrier, I mean, that seems like something we've never really talked about before. And so it seems like you would never know how many people were walking around with it unless that antibody test was used as a data point.
Yeah, exactly. I think that's what I think people don't know exactly how to use the antibody test. And I think there's concern about using it because there were these discussions about like, well, could you use antibody test results as these quote certificates of immunity, which was an idea that was floated around. And now, it's possible that it might provide some information, but there's been a real pushback on knowing whether if you had antibody to the virus, that you would have protection against being reinfected.
Right. Like we're not sure that that's an actual thing.
Yeah, there's a question about whether the antibody levels are protective enough to prevent against reinfection. And also, if they are protective, how long that antibody will be protective. So, do you have waning immunity over time? And this is the rationale behind why you need a booster for a vaccine, for example. Is that over time, your antibody coverage, your antibody levels wane. So you need to boost that immunity with a new dose. And we don't really know what confers immunity for COVID. It's too early. So then what do you do with someone who says, okay, I've got a reactive antibody test, I've been exposed and infected with COVID. Do you have sufficient antibodies to prevent infection again? We don't know the answer to that. But at least it would tell us, like, preliminarily data, like how many people have even been exposed and infected, because it is possible that we might be getting close to herd immunity where you have more general protection in the community because more people have been exposed.
Well, I think it's still a bit hard to get even an antibody test. The UW one requires you to have a doctor's note, which it is a little bit difficult to get a hold of a doctor right now. I've got a friend who got really sick at the beginning of March and would love an antibody test. And she called UW, spent a long time on the phone with them. And they said, we really, really want you to come in and get this test, but we have to have a note from your doctor. And so now she's going on down this whole path to try to get, an order from her doctor, but her clinic is closed. I mean, it's a nightmare. And so there are so many complicating factors to getting people tested that it seems very daunting.
Yeah, and for some clinics, telemedicine is certainly one way that might work, where you might be able to just call your provider, ask for a test. It's not clear to me what criteria the healthcare providers are using on determining who should get a test and who shouldn't get a test. And, what does it mean if you get a test result? And often we don't screen for conditions that we can't do anything about. But in this case, I think it does actually provide people with a sense of relief if they were infected. And that said, you also don't want to have false understanding of what the results mean. So if your test results were positive, that doesn't mean that you can stop social distancing. We don't know yet whether that confers immunity. And so I think communicating what those results mean to the public may be part of the hesitation to do more antibody testing, is that it could backfire to have people say, oh, I've already been infected, I can go back to normal. And that might be true, but we don't know that to be true yet.
It's interesting because this, again, speaks to the underlying feeling that the information is being manipulated a little bit. And I mean, that's kind of like, I've kind of cut down my internet usage and Facebook and social media because you can't escape the two sides of this argument. It's really interesting having this community say we need to reopen our state. There isn't data to support every single county being closed. It's unfair. It's unconstitutional. And it's something that I think you and I talked about. For sure this would happen, in March. People want to reopen. They're losing their livelihoods, their businesses. But it's interesting to see it manifest.
Well, and there's a lot of media out there, and media can be very influential. I don't know if you heard of or saw, I didn't watch it, but I read the synopsis about the pandemic video, and people make very compelling arguments. And just like any data, you can sort of twist things in a way that makes it seem like, yeah, why are we doing all of this? Some researchers who have studied this, there's a few outliers who say, this is all excessive. We don't need to be doing all of this. So there are other voices that are very easy to latch onto. And you can say, look, here's an expert. They don't believe we should be doing this. And if that's going to promote what you want to happen, I mean, we all really would like our economy to open up, our country to open up, for us to be able to go back to normal. We all want that, but it's trying to weigh the evidence carefully. And I think that's the most difficult thing to do right now, is to say, what information can you trust? Who can you trust? And I think a few pieces of information that are compelling to me is when you look at the excess mortality. If you look at what the excess mortality is now since COVID started, you're seeing more mortality in 2020 than over a 5-year average. So that sort of accounts for year-to-year fluctuations. But during this season, which you also have to account for seasonality, that we're seeing more deaths now. And why is that?
Yeah.
And some people will say, oh, it's because the people who are sick can't get access to facilities, and they are maybe dying of things that would have been preventable if COVID wasn't going on. Like, they didn't get their cancer treatment, they didn't get the surgery they needed. And that's possible. I'm not going to say that that isn't possible. It's also possible that mortality could be even lower if you're doing things that are healthier. For example, we're not getting in cars or car accidents, even though the recent data locally shows that that isn't a huge factor here. It could be in other places. And other things that are risky that result in death are maybe things that we're not doing as much. So it can be both, like we have a higher risk because people are stressed, there's more heart attacks, lifestyle factors are contributing to more disease and lack of access to healthcare, but it also could be there's things that are driving lower mortality. But to see that we have an excess mortality now related to COVID, and that we saw, I mean, I think most people saw the images from Italy and New York City, like that was a real experience. People, their healthcare system was really overloaded.
Right.
I know physicians who have friends and colleagues who are providing clinical care in New York, and it was not a pretty picture. Like, it was a very stressful environment. It was difficult for them to operate in. It was the amount of deaths that they were seeing on a daily basis it's a lot for a healthcare system to absorb. So we have to remember that when we're looking at the data or saying, well, look what's happening, or look at the deaths that aren't happening, it's also because we are practicing social distancing. We're not in a vacuum. We didn't just open up our doors and say, let everybody do whatever they want, resume life as normal, and then see how the epidemic played out. We shut things down, and we started
Right.
to see infections decline, hospitalizations, mortality are declining because of the social distancing. If you release that valve, that's why we're expecting to see second waves. And how do you balance the needs for health versus economic and mental health? It's not an easy decision.
It's not. I mean, the mental health piece is so huge. I was just talking to a friend, and I've never had the experience of talking to so many people who are so down all the time. And even one of my friends who had been so, really positive through this whole thing and really passionate about it, asked for a video conference this week. She's like, can we just have a video chat? Because this has just been miserable. And she was kind of the last one for me to kind of go down. And I just thought, man, this is getting real. The depression is real for people that don't have depression. I had a little bit of a personal meltdown a couple weeks ago because of a few things, but my house cleaner had texted me and she said, I've been quarantined. I would be happy to come clean your house. And I looked at my phone and I just was like, I don't know. I don't know what to do. I don't know what the right thing to do is. And I really have kept feeling that way about decisions that I'm making for my family. And that is getting so mentally exhausting. And I know I'm not alone in that.
Yeah, the whole thing is mentally exhausting. And I think a lot of people cycle through, some days you can find the silver lining and say, we should be grateful. We should express gratitude for what we have. We have our health. We're not in the middle of a war. There's other things that are much worse as a community to experience. And in a way, we get to go outside, we get to go for walks in the sunshine. There's still good things to look forward to. And the days when I can focus more on the positive aspects of what we have and the opportunity to get to know my children in a different way, see them learn and grow, those are my good days. And on the bad days, it's, we're not meant to live like this. We're social creatures. We're meant to have interaction with other people. And I even saw something recently about the Zoom fatigue, of sort of a psychology about why you feel so tired after many people who are working are on Zoom calls after Zoom calls, and that it's much more fatiguing to be, even if it's social, even if it's call up your friends or your family and, do the Zoom happy hour. that just kind of being on in that way. And I was thinking about, yeah, even when you go out with your friends, if you had 5 friends on a Zoom call, if you were in person, you could have side conversations with one other person. You could have 2 or 3 different
Yes.
conversations going on, and you can't do that on Zoom unless you want to move people into a breakout room, which is odd. So
Then it becomes really obvious that two people are talking about you.
yeah, exactly. So just even having more intimate conversations instead of a group mentality. And like the larger the group is, the more fatiguing it is to be on, to be having like a camera in your face. Not everyone, is comfortable having that all the time. So even the positioning of the camera
Yeah.
they talked about can be helpful. So this is difficult for all of us. And as, we look forward to things like seeing friends, families, going on trips, enjoying our, summer, it's even more difficult to think about like what this is going to look like in the future. And I think my best hope would be that as we learn more about how infectious the disease is, where risk really is highest, that maybe as that data comes out, it will inform our social distancing practices. Social distancing is likely to stay, right? But like maybe it gets modified in a way that we realize that some of the things we're doing maybe aren't as high risk. But if we don't know, then we need to just shut everything down. But if we know that a lot of the cases are not happening when people are outside, and if they are kind of able to keep social distancing for the most part, when they're outdoors, with the exception of maybe smaller groups. And that's really like the phase 2 and phase 3 of our Washington state plan is the group sizes can get bigger, and that would really, we'll be grateful for the small changes over time. And so once we can appreciate that and can start to like see another person outside of your household, it will be more palatable to do social distancing. But in the absence of that, people are forced with the fatigue of determining like what's safe to do, like how do I best implement these practices? How can I be a good global citizen? And then also personal assessment of risk. So like, can your house cleaner come
Right.
back? What if I just talk to my friend or neighbor? Like, could we sit on our back patio 6 feet apart and talk? Like right now, technically the answer is no, because that's a grouping, but you are social distancing. So things like that, I think, would make this a lot easier to follow. But for now, it's pretty difficult.
It really is. And people's fatigue is starting to show. And I've heard, of quarantines, which had I known then what I know now, I absolutely would have tried to have another family be a part of our pod sooner. Like right at the beginning of lockdown, having that agreement where like we'll shelter in place for 2 weeks and then, because people have done that. And I think it's really smart to at least have another, group to socialize with. But there's this weird dynamic happening too, where you put feelers out to see who's comfortable with what. And, it's just crazy. And it makes you feel a little bit crazy. One of my friends sent me this fascinating article this morning. I don't know if you've read it. The author is Aaron Bromage. I'm not sure how you pronounce his name, but he put out a blog post about the risks. The name of the article is The Risks, Know Them, Avoid Them. And I will link to this in my show notes also because I thought it was really interesting. And it's kind of a basic epidemiology lesson on exposure plus time equals infection. And I hadn't really totally considered that, but the article is basically saying, people are getting sick because of, massive amounts of droplets, like in the flush of a toilet in a public bathroom and an infected person at a restaurant breathing into the air conditioning system or coughing and it gets circulated by air conditioning. It's really interesting. So you do kind of think about, even if everything opened tomorrow, what would I really truly be comfortable doing?
Yeah, exactly. I actually did read that article, and I didn't go through, kind of with a fine tooth comb to like try to figure out some of the flaws in it. Although I did hear some people in the epidemiological community said, oh, there's some flaws with, the way that was analyzed. But overall, I actually did feel like I agreed with a lot of the statements and really thinking about like what's risky, what's not risky. So for example, our childcare center is opening up for our children. So they are going to do childcare full day, like it's camp starting now. And that is actually in response to one, it puts people back to work. The daycare or childcare centers are at risk of closing if people can't, find children to go to them. And also that
Right.
because essential healthcare workers or essential workers need access to childcare, that it does open up the spots that aren't needed for non-essential healthcare workers to put their children in childcare. And I think it's a great strategy to begin moving in that direction because one, like our children also are suffering from, this social isolation. And that was one of the primary factors that drove me to say, I'm going to put my children in a few days a week because I'm seeing that they need more interaction with people and their parents just aren't enough for them. It's fatiguing.
That has been honestly the hardest part for me. And I realize I am a terrible playmate, but it's this bid for connection from them. Like, Mom, will you come play Lego with me? And you're like, ugh, okay. And it's like, I'm not the same as other 8-year-olds who are like, hell yeah, let's figure out how to build a, spy cave. So that has been the hardest part for me is kind of A, feeling like a terrible mother because I don't want to play all the time. And B, they're sad.
Mm-hmm.
And we don't have a daycare because I'm a stay-at-home mom. But I'm starting to feel like if I did have that option, I might take it because they are lonely.
Yeah, I agree. I think you have to weigh the risks of what's the risk of exposure? What's the risk of, morbidity, mortality for your children, for the other people who are, going to the facility? But then what are the benefits? What are the reasons that they should go? And that's where I found the balance of, I think, going a few days a week, they're already in smaller class sizes. They're already doing tons of disinfecting,
right,
social distancing. The kids have to wear masks, which is new for my kids because they have not done that yet. When we go out, we social distance. We walk in the middle of the street to avoid people on the sidewalk. So they haven't done any masks. So it'll be quite a change for them to go to all day mask. But as you were alluding to earlier, what are we going to be comfortable with? I mean, I didn't do a survey of our whole center or anything, but I did reach out to a few of our children, of the friends of our children, to say, what do you think that you might be comfortable with? Are you going to put your children into care? Because we could align the schedules. And I didn't find anyone who was going to do that.
Really?
Yeah. So I think that there is a reluctance about what people are willing to do. And you see this in other parts of the country too. The restaurants are allowed to open. Some restaurant
Absolutely.
owners say, I'm not going to do it because I'm not going to put my own workers at risk. And other people are saying, well, we're not going to go to the restaurants because they don't feel comfortable going. So even if you open up, you're going to have widely varying degrees of what people determine are risk. And it's been one of the most interesting things about the pandemic for me is thinking about how people perceive risk. And
Yes.
this has happened before the pandemic. I had it when my son was younger. He would climb all over and he'd climb up high and he'd climb around the sides of our houses, and people would stop and say, do you realize that your son's doing this? But I knew my own child. I knew his limits. I knew what he was able to do. And I was comfortable with that level of risk. But, as a society, we now are moving towards other people telling you what's an appropriate level of risk. And, it all comes from a good place, right? People want to be protective. They want to make sure that your children are safe, but it's also led to things like helicopter parenting. And this is now just a new reincarnation of that same idea, right? It's
so true. Yes.
What should you be doing? What are you doing? Are you wearing a mask?
And really genuinely judging people for doing what they choose to do. There's a very real entitled judgment if somebody makes a different choice than you.
Yeah. And we can't help it, right? Because we all want what's best. And so if you really truly believe that this is what's best and someone else isn't doing that, I mean, I think if we all walked into a grocery store right now and we saw someone coughing all over the oranges, we'd be like, that's not really cool. At some point, there is, yeah,
Mask
at
up.
some point there is a judgment that is appropriate probably. But, I think when there is a little bit of gray, and maybe also not to judge people. So the other thing about the other families is that one of the families mentioned that they have kind of included a grandparent in their network. And I think more and more people are doing this over time. I hear more and more about it as I'm, talking to people in our own community and elsewhere about who is doing what with family members or neighbors. And that, well, if you've been doing social distancing for a long time and the other group too, that you can make that kind of pact with your pod to say, you're my person, you're my family, and we're not going to do anything outside of that. And if you include a grandparent in that, then maybe the best choice for your family is to not send your child to childcare so that you can maintain that interaction and protect those who are most vulnerable. That makes like perfect sense to me. So to just make judgments on what other people are doing, you don't know why people are making the choices they're making. And this goes back to what we talked about on the last time, which is people will have to make choices for themselves and to make the best educated decision. And hopefully they're also following the guidance. But, there is some interpretation of the guidance too.
Well, and I will tell you, there are some grandparents like my parent who are just over it and stubborn. And, she had an appointment at Molbach's yesterday, and she is deciding for herself what her risk tolerance is and what's worth it and what's not. And I actually, in some ways, kind of admire her take on it, because she's like, I will not be scared of this. I can't live in fear constantly. This is going to be around for a while. And I will tell you, after my little, come to Jesus moment a couple weeks ago, I did kind of pick myself up, and it's like, you know what? I have sheltered my kids from this literally for as long as I can. And, we need to really back up and kind of understand that this is going to be a part of our life for a while. And the more we normalize it for them, maybe the better it's going to be. So my kids hadn't been to a store in 2 months. And last week I kind of looked at our pots on my deck, and I'm like, I think it's time to fill these. And I told my son, Luke, I was like, you know what? Do you want to just go to the garden center with me at Fred Meyer? Like, do you think you'd be comfortable with that? And he was like, yes, please. And so, we masked up and we gloved up, and he was totally in on it, and he didn't touch anything. And we ended up having a great time, but I thought he would be more freaked out by having to wear a mask, and he wasn't. Kids really are so resilient.
Yeah, I think so too. I mean, we're looking at ordering our new masks, and they've like picked out fun like covers for them. You have to make it fun, right? Because if they're going to be subjected to doing this, it should be like, now it's the new fashion accessory is your mask. And what does your mask say about you?
Well, and it doesn't necessarily mean that, you're going to get sick. It just sort of is, right? Like, it's putting on a coat when you go to the store, and you just do it. And then they see everybody else doing it, and you're like, okay, this is super weird. But like anything else, you just kind of get used to it, I think. I mean, I never thought I would say it, but we ended up having a great time, and, we threw away our gloves at the end and sanitized our hands and threw our masks away, and it was fine. I think I've hit the point where it's like, okay, we have to figure out how to make this normal. And for me, I am a tremendous extrovert. And so it's been a challenge for me, but also like figuring out for myself how I'm going to have the willpower to really only kind of start including a couple of families into the circle as we're able. It's hard.
Yeah. I mean, I think the more that we learn, the longer it goes on, like you start to get more creative and more adaptive to like, okay, well, what could we do? And now, like, if we wanted to think about like, how could we follow the rules, but also make sure it's safe? So, but you have to like have an understanding. And I found that even just having the conversations, and you have to first start with like initiating the conversation, right? You have to have that vulnerability to ask someone else to say, what are you comfortable with? And then just find the middle ground. So I did this with a parent recently where we talked about our kids and, what are the kids like? What are their behaviors like? Were we comfortable with them doing something like, could they kick a soccer ball around, or could they touch something like play ladder ball? And, we decided not to, because some of the kids are not very good about like keeping their hands out of their mouth. So we just, that's a personal risk. Like my kids can do that
because they are children.
Yeah, my kids can do that. Other people can't do that. So that's fine, right? You just like, you have to adjust to like what's reasonable. And then another family, we have gotten into like a daily bike ride with 2 of our kids. And the kids, you really can't be 6 feet.
No.
If you're behind each other anyway. And so they go out and they ride their bikes together. So like they're social distancing. They know to stay away from other people. They're old enough to be able to do it independently and on their own, which is great because it gives them a little bit of space away from adults too, because our kids are just not meant to be with like their nuclear family 24/7. And for people who already live in multi-generational homes, you could also make an argument of like, well, if you lived in a family where grandparents were already part of the mix, or maybe, aunts, uncles, cousins, sisters, some other member of your family happened to live in your home, then how different is it if we were to like band our 2 homes together and say, you're within our pod? it actually makes sense to me that that's a logical approach, especially as we move forward with doing this, and to avoid the isolation of people who might be, living alone or single parents, or, whatever their unique situations are that make them even more isolated with social distancing and, ways to be inclusive. Makes perfect sense to me.
Yeah, we had kind of a unique opportunity to rent a house for the summer on Vashon Island. And it is next door to one of my really good friends, and she has kids the same age. And we kind of decided that this is going to be the sister wife compound of our dreams, actually, this summer, because both of our husbands are working, and she's actually a nurse and she works 2 days a week. But we just kind of thought, okay, we are comfortable with this, and at least we know that our kids will be able to play together, and that we're going to be, comparing to what our level of social interaction is normally. Everybody is really extremely socially distanced right now. And so that was kind of both of our comfort levels. And so that's been really reassuring, even for our kids who haven't seen other kids. They're so pumped to finally hang out with their friends. It was a total gift from God, and we're so lucky. But it is just a level of risk assessment and feeling each other out and being like, okay, well, I might be open to this. Are you going to judge me if I'm open to this? It's like a whole other level of mom dating.
Yeah. And I think if you could just have mutual respect for the other person, and if they're not, to not be judgmental, and that you just have to hope that they're not judgmental of you, that's really where you can come up with collective decision making to minimize risks and get through this together in the best way that we can.
Yeah. And I need a place to go where I'm not tempted to hang out with people, frankly, because I'm the problem. I'm the problem. I would be the vector, but like I said, my husband is going back to work. And for me, it was really being forced to get comfortable with, hey, we've got to live with this. I have a healthcare provider in my nuclear family, and I want him to be able to give care to kids. I firmly believe that he is the best. And I think kids need him right now. I think dental health is such a huge deal. It's the number one reason kids miss school is because of dental pain. And so I want kids to be able to get healthcare. Super passionate about it. And that's why I kind of bucked my head and was like, all right, we got to get comfortable with this, because this is going to be a risk that we live with in our household. And B, this is going to be something that we live with for the next year and a half. So let's figure out how we are not going to live in fear.
Yeah. And I think, it's interesting that you mentioned the healthcare aspect, especially for children, because the other kind of sub narrative that I've been hearing is well, what happens when children miss their own healthcare visits? And
yes,
we're looking at immunization rates decline. And then you could have this superimposed epidemic of another infectious disease that is preventable through vaccination. But if people are afraid to go into the healthcare systems to get their routine immunizations, I'm hoping that this is still we're in the temporary phase still, even though it feels like forever. If you can only say it's only been 2 months, and 2 months is not a year, and that people will start to come back in. I got an alert from my own healthcare provider saying we're still seeing patients. That we do need to find ways to feel comfortable with it, and finding those strategies that work for you, and find things that you can do with within the rules, and hopefully the rules change. But especially when you live in a very dense community where a lot of families rely on parks as that is their outlet. If you have a small yard and your park is closed, especially for playgrounds for younger children, that's a problem. Where are you supposed to go? What are you supposed to do with them? You can't send them to a friend's house. You can't send them to the neighbor's house. And I think when everything shuts down, it's not just that we're home and feeling like we are, prisoners in our own home. It's also that the number of activities and the things you can do, you can't round it out by just go play with a friend, or, let's go for a hike, here, because even that now, I think there's concern about the trails being overwhelmed. And so it's a challenge to get creative to find the things that you can do, and having more space is actually one that a lot of people do right.
What new have we learned? Where are you at right now with where things are? And give me your state of the union as we kind of think about signing off here, because in some ways I feel like we know so much more, but in some ways since March 28th, I feel like we're totally stagnant. How do you feel about it?
Well, I think I think initially it was like short-term game. It's, we're all doing what's best for our communities in the short term. Let's alleviate, like, let's flatten the curve. Like, you don't hear people talk about flattening the curve that much anymore because most communities are already out of their peak. So I think, we're past that phase. Now we're looking at these projections of, this is a short term to changing our mindset to the long-term game and really doing a lot of things that we're talking about, like, how do we operate and live within this new normal, and how can we make it work? How can we do what's best for ourselves and our families? It's sort of acceptance that, like, this isn't going away. This is unlikely to go away as much as we all would like it to, and that we will have to navigate this and we'll have to be flexible. In addition to, we're just going to have to accept uncertainty. Everyone wants to know, what tomorrow is going to look like, what August is going to look like, what September is going to look like at schools. And, there's hints, like there's been some discussions about maybe children will go back like 2 days a week with 10 kids in a class or something. I mean, those are specifics. No one has mentioned those specifics. But I have a colleague in Geneva who said that they are starting schools, and that for her children, that means 2 days a week. So you can look to other countries and see what they're doing as, possibilities of what could be happening here. For distance learning, I don't know what that will look like for schools, if they're going to like do more, or if they're just going to try and pack everything into a 2-day class schedule. It's hard to know.
It's going to be really interesting.
Yeah, we'll have to be creative. And, as we learn more, science is really accelerated. If I think about like how much progress we tend to make over, a year, for example, and how many people are doing COVID related research or understanding more about like community spread, testing, thinking about novel strategies, it's actually quite impressive to me, the amount that we have learned over such a short period of time, even though we were, slow to start, and would have been nice if we knew more earlier.
Wouldn't it have been? It would have been so nice.
So, I mean, I'm trying to be hopeful that, as we learn more, that we will adapt and we will come up with things that, make this new normal palatable. But in the meantime, we're stuck with just sort of like following the guidance that we're given to do what's best for the community. And, you have to have faith and trust that, people are doing this for the right reasons, not politically motivated, and really just using data as our guide.
I do have a hard time believing, at least in our state, that all of this is crazy political. But then again, it's like this fundamental, like, I have no idea what to believe. No clue. So it's just so confusing, and I never predicted being in this situation.
Yeah, I think a lot of us go through that. Like, is this really happening? Like, is this real? Like, you have this sense of like, this is so abnormal that it almost feels like you're living, some sort of dream or nightmare.
Yeah. And it's stretching to explain it, right? Like, it's saying, well, the government's clearly lying to us. It can't possibly be this bad. And you're like, I don't know. I
just have a hard time seeing what the motivation is. Like, what would be motivating about that? Why would people want the economy to tank? Like, it just doesn't, to me, it's not a compelling argument to say that this is, politically driven, that there's some underlying agenda, and that people would go to this level of extreme in order for this to happen. It just doesn't make sense to me.
Yeah. There's a lot that doesn't make sense on every direction. But again, as I said earlier, it's that conflict where you kind of step back and you're like, I literally have no idea what or who to believe right now. And so maybe I'll just turn on some Real Housewives and put my phone down. That's been my coping mechanism.
A little bit more of like checking out of the media and just trying to like put it aside a little bit more frequently. I mean, I'm certainly doing a little bit more of that than I was in the early days. The changes from day to day are less impactful as they were. You kind of get a sense, like, there is a little bit more of acceptance and normalcy to it, as strange as that sounds. And I think that helps to kind of feel like you don't have to know what's happening minute by minute or what the latest is. That said, I mean, there's also like the new data coming out that for Washington and other places, that while like the curve maybe has flattened, that it's really not getting down as like flat as we would have liked it to.
Right.
And that in some places maybe is even increasing. And that is probably like the future of rural America, in places where there hasn't been as much penetration, that they're just delayed and they may see more I mean, it's contingent on like how much social distancing is happening and how much movement is happening within communities. But this isn't over. And, New York has done very well. Washington has done very well. But the rest of the community still, the rest of the country still is increasing. Like, we're not seeing like the curve flattened yet for the country, really. So there's still a lot to do.
There's so much to do, and we can only just keep watching and waiting. But thank you so much for coming on again and giving your read on this constantly changing scenario. I do have one prediction, though, that has given me a little bit of hope. And as we're looking at my husband's practice open, which is incredibly stressful. I mean, anybody working frontline healthcare right now is under an amount of stress that I really, truly can't imagine. Just the level of PPE they've got to wear and having to work through that and carry people's stress is just such a huge job. But as he's looking at reopening, we're like, are people going to want to come? And I wonder if it'll be slow to start because people will be scared. But then as we all kind of realize that we're trying to take really good care of each other, if it won't start to normalize a little bit in a really nice way. So that's my hope. I don't know if it's completely displaced, but I do think that slowly but surely we're going to embrace this normal of masking, sanitizing, washing hands, and trying to figure out a life moving forward. I mean, humans are malleable.
It will likely take time for things to change. Whenever something is new, there's not usually a large group of people who want to adopt something new. And so this is now new, as strange as it may seem, like going back to do the things that we used to do within this environment of the PPE and the hand sanitizing and social distancing, like now doing things that used to be routine within this environment are new. So for you and your family, it's like, will people come back to get their dental care? In my world, it's like, will the kids come back to their childcare? Will they like be able to see their friends? And, I think the early hints are yes, but maybe not now. So for example, in the childcare situation, people have said like, we're staying out through June, but then they've signed up for like July and August. So it's just the, yes, but not yet. And, the restaurants in Atlanta and the other places have found that same pattern. And I think we'll find that too, that, more families will do this. Like, how can we make this work? As things start to open up, we won't be able to do everything that we want to do, but we don't know exactly what those activities will be. And that over time we will accept it. We will, do what we need to do to follow the rules within, limits. And it's just going to take time for us to figure out like what's safe to do. And postponing things you can do for short periods of time, but you can't do it inevitably. So, we have all been on lockdown. People have postponed surgeries and routine care and seeing friends and family. And some of those things we may be able to resume in the future, and other things we may have to wait longer for.
All this talk about the new normal, it's so difficult to really realize that our entire way of life changed almost literally overnight. To close this up, I just want to share some thoughts I have about pressure. While we've been sheltering in place, I've felt a lot of things come in my direction. I am helping facilitate my kids' learning now. My husband has been working quite a bit and contributes as he can, and it's super helpful when he does, but the percentages still fall in my column. I feel pressure to be a teacher. I feel a tremendous pressure to try to model a calm, nurturing, emotional state, which I can't always maintain. I feel pressure to be emotionally supportive. I feel pressure to be a cheerleader and a therapist for my confused kids. Oh, also, don't gain any weight. Here are 1 million home workouts on Instagram so you can still be pretty. Also, you can't get zits. You got to do a whole masking thing. Instagram will tell you that too. And if you work, you also need to be a team player. You need to still produce. You need to be on time. Oh, and by the way, here's some pressure to cook some amazing home meals. And by the way, still keep your house clean, and on and on and on and on and on until I crack. I'm trying to give myself and my kids so much grace right now, but I still continue to feel so much pressure. It's not coming really from anyone but me, but I feel it. And I'm admitting this to all of you because I bet I'm not the only one caving under this tremendous pressure iceberg right now. With summer looming over all of us, my goal is to try my best to let go of a lot of the things I'm pressuring myself to do right now. Maybe I'll get less confused as life resumes, but for now, I am eternally grateful for every call, every text, every email I get from people that I love. Please continue to reach out to your friends, even if you feel kind of dumb doing it. People still need each other during this time. There are still big things happening right in front of your face, even when you're 6 feet away.